Emergency birth control, which includes different kinds of pills, helps prevent pregnancy for up to 5 days after unprotected sex. It does not protect against sexually transmitted diseases. Here's what I tell my patients about using emergency birth control. There are two main kinds of emergency contraceptive pills. One kind contains the hormone progestin, one of the hormones in regular birth control pills. It can lower your chances of getting pregnant by 75 to 89% if you take it within 3 days after unprotected sex. It's available over the counter for all women of all ages. The other kind contains a medication called ulipristal acetate, which works differently to delay ovulation. It lowers your chances of getting pregnant by 85% if taken within 5 days of unprotected sex. It's available only by prescription. It's more effective than other emergency contraceptive pills because its efficacy doesn't decline the longer you wait to take it. If you're past that 3-day window, call your doctor or pharmacist to ask about your best options. You might get your next period late, and you might freak out thinking that you're pregnant, but this is totally normal, and your period could be really heavy. You shouldn't use emergency contraception as your go-to birth control method. For starters, it's not as reliable as routine birth control, and it's more expensive and may have more side effects. Nausea is a really common side effect of morning after pills. If you throw up within 2 hours of taking the pill, it won't be effective and you'll have to take it again. Fatigue, headaches, dizziness, breast tenderness, and cramps are other common side effects.